Hello, everyone. Today, we have an essential lesson on identifying and reporting adverse events in endemic communicable diseases in Kenya. I'm Dr. Ann, and I'll be your instructor for this session. In Kenya, communicable diseases like tuberculosis (TB), HIV, AIDS, and malaria continue to be significant public health challenges. While we focus on disease treatment and control, we must also pay attention to adverse events, AE, that may occur due to medications used in managing these conditions. Adverse events can range from mild discomfort to severe reactions, and reporting them is crucial for patient safety and effective disease management. Let's take a look at the learning objectives for today. 1. Understand the significance of identifying and reporting adverse events in endemic communicable diseases. 2. Recognize common adverse events associated with medications used in the treatment of TB, HIV, and malaria. 3. Implement best practices for adverse event reporting to enhance patient safety and contribute to disease control efforts. 4. Appreciate the role of adverse event reporting in pharmacovigilance and public health initiatives. Now, let's delve into the significance of adverse event reporting in communicable diseases. Why AE reporting matters. Adverse event reporting is essential to monitor the safety of medications used in treating endemic communicable diseases. We can detect and manage potential reactions by promptly reporting adverse events and preventing patient harm. Unique considerations for AE reporting. There are some unique considerations when reporting adverse events in communicable diseases. These diseases often require long-term treatment, and patients may experience interactions with other medications, leading to additional adverse events. Impact on public health. AE reporting benefits individual patients and has a broader impact on public health. It helps identify safety issues, informs healthcare policies, and improves drug safety profiles for better treatment outcomes. Let's now explore some of common adverse events in TB, HIV/AIDS, and malaria treatment. TB medications. Common AE may include gastrointestinal disturbances, hepatotoxicity, and drug-induced fever. Understanding potential interactions with other medications is essential in TB treatment. Adverse events associated with antiretroviral therapy, ART, for HIV, AIDS, ART-AE may vary based on the specific antiretroviral drugs used. Common AE may include nausea, headaches, rash, and lipodystrophy. Adverse events associated with antimalarial medications. Antimalarials can cause gastrointestinal disturbances, dizziness, and skin reactions. Monitoring for potential drug resistance is crucial in malaria treatment. Now, let's discuss some best practices for adverse event reporting in communicable diseases. Strengthening healthcare provider awareness. Regular education and training on AE reporting should be integrated into medical curricula and professional development programs. Clinical guidelines should also include specific instructions on recognizing and reporting adverse events. Engaging patients in AE reporting. Patients play a crucial role in AE reporting. Educating them about adverse events and establishing patient-friendly reporting channels encourage their active participation in the reporting process. Collaboration with health authorities. Collaborating with national and global health authorities enhances Kenya's capacity to monitor adverse events and receive updates on drug safety. Sharing identified AE data contributes to a broader understanding of medication safety. Let's explore how AE reporting supports disease control efforts. Supporting disease control programs. AE reporting aids in detecting potential drug-resistant strains and treatment failures. Identifying adverse events associated with disease control interventions allows for improved strategies. Enhancing pharmacovigilance. AE reporting ensures continuous monitoring of drug safety profiles during disease outbreaks. Regular analysis of AE reports helps healthcare providers make informed decisions about medication use. Now, let's examine real-life case studies of identifying and reporting adverse events in endemic communicable diseases in Kenya. These case studies aim to highlight the importance of AE reporting in endemic communicable diseases and how prompt reporting can lead to appropriate management and improved patient safety. Mr. CRK-CRO, a 4 to 5-year-old male diagnosed with drug-susceptible pulmonary tuberculosis. Adverse event. Mr. CRK-CRO visits the clinic complaining of nausea, vomiting, and jaundice after starting TB medication. AE reporting and management. The healthcare provider recognizes the symptoms as potential drug-induced liver injury and halts the TB medication immediately. Liver function tests confirm the adverse reaction, and the provider reports it through the pharmacovigilance system. Mr. CRK-CRO is provided with alternative TB medication and is closely monitored for improvement. In this case study, we have Miss Aching, a 35-year-old female living with HIV/AIDS and on antiretroviral therapy for the past 3 years. Adverse event. Miss Aching experiences severe headaches, dizziness, and blurred vision after a recent change in her ART regimen. AE reporting and management. The healthcare provider suspects and promptly reports a possible adverse reaction to the new ART medication. Miss Aching's ART regimen is adjusted and her symptoms subside. The AE report evaluates the medication's safety profile and informs future prescribing decisions. In this case study, we have child, 6-year-old, diagnosed with uncomplicated Plasmodium falciparum malaria. Adverse events. The child's caregiver reports that the child is experiencing abdominal pain, vomiting, and diarrhea after taking the prescribed antimalarial medication. AE reporting and management. The healthcare provider suspects a potential adverse reaction to the antimalarial medication and documents the symptoms. The child is provided with supportive care, and the AE is reported through the pharmacovigilance system. The report contributes to monitoring the safety of antimalarial medications and may prompt further investigation. Before we conclude, let's recap some key takeaways from these case studies. Recognize and promptly report adverse events to prevent harm to patients. Adjust treatment regimens when necessary based on reported adverse events. Engage in pharmacovigilance efforts to enhance drug safety profiles for communicable diseases. Thank you all for your active participation. I hope you now understand the importance of identifying and reporting adverse events in endemic communicable diseases. Let's continue working together to ensure patient safety and improve disease management in Kenya. Have a great day.